Welcome to TelehealthFX Talk. If you've spent any time on TikTok or Instagram lately, you have probably seen the hashtag Ozempic Babies, women sharing stories of surprise pregnancies while taking GLP-1 medications. And we're not just talking about one or two cases. We're talking about women getting pregnant while on the birth control pill, and women getting pregnant after struggling with unexplained infertility or PCOS for years. It's become a massive viral phenomenon. But beyond the social media shock value, there is real, fascinating biology happening here. Today, we're going to break down exactly how GLP-1 medications impact fertility, why they interfere with birth control, and the critical safety guidelines every woman of reproductive age needs to know. If you're looking for a clinical team that actually discusses family planning and metabolic health with you, visit TelehealthFX.com. That's TelehealthFX.com. Let's get right to the biology. Why is this happening? There are two completely different mechanisms driving the Ozempic Baby phenomenon. The first has to do with restoring your body's natural fertility. I want to be very clear. GLP-1 medications are not fertility drugs. They do not directly stimulate your ovaries. But what they do is drastically improve your metabolic health. They reduce insulin resistance, they lower systemic inflammation, and they facilitate weight loss. For women with conditions like polycystic ovary syndrome or PCOS, which we talked about in episode 10, excess weight and high insulin levels often disrupt hormones and prevent ovulation. Exactly. When you take a GLP-1 and that insulin resistance drops and the weight comes off, the hormonal block gets lifted. The reproductive system essentially wakes up. Women who were previously anovulatory, meaning they weren't ovulating, suddenly start ovulating regularly. So women who assumed they were infertile because they hadn't used protection for years without getting pregnant are suddenly highly fertile again. And boom, surprise pregnancy. But what about the women who were using protection? That brings us to mechanism number 2, birth control interference. This is something every woman on a GLP-1 needs to be warned about. GLP-1 medications work in part by slowing down gastric emptying. They slow down how fast your stomach digests and empties food into your intestines. But it doesn't just slow down food. It slows down the absorption of oral medications, including the birth control pill. Right. If the absorption of your oral contraceptive is delayed or disrupted, the hormone levels in your blood might drop below the threshold needed to prevent ovulation. Furthermore, if you experience gastrointestinal side effects like vomiting or severe diarrhea, which are common when starting or increasing a GLP-1 dose, your body might literally expel the birth control pill before it has a chance to be absorbed. Because of this, clinical experts strongly advise women on GLP-1s who do not want to get pregnant to consider non-oral methods of contraception, like an IUD or implant, or to use a backup barrier method like condoms. So what happens if you do get pregnant, or if you actively want to start trying? This is where the clinical guidance is very strict. GLP-1 receptor agonists are not recommended and not approved for use during pregnancy. While the human data is still evolving, animal studies have shown potential risks to fetal development. If you discover you are pregnant while on a GLP-1, standard medical advice is to stop taking the medication immediately and contact your OBGYN. And if you are actively trying to conceive, there is a mandatory washout period. Because medications like Semaglutide and Tirzepatide stay in your system for weeks, the FDA and major clinical guidelines recommend that you stop taking your GLP-1 medication at least 8 weeks or 2 full months before you attempt to get pregnant. Which brings us to the catch-22 that so many women face. Many women use a GLP-1 specifically to get healthy enough to conceive. But stopping the medication 2 months prior to conception, plus the 9 months of pregnancy, means going off the drug for nearly a year. Emerging clinical data from 2025 and 2026 shows that when you stop a GLP-1, you run the risk of rebound weight gain and a rapid return of insulin resistance. If your metabolic health deteriorates right as you get pregnant, it can increase the risk of gestational diabetes and hypertensive disorders. Managing that gap is one of the most complex challenges in obesity medicine right now. It requires tight coordination between your prescribing physician and your OBGYN to have a plan in place. You have to aggressively manage your lifestyle, monitor your blood sugar, and have strategies to protect your metabolic health while the medication is out of your system. And this is exactly why you cannot treat GLP-1s like a casual cosmetic supplement. You need clinical oversight. This is why TelehealthFX is so valuable. When you onboard with TelehealthFX, it's a one-on-one process with a licensed clinician. It's not just a rubber stamp. They look at your complete medical profile, which includes your contraceptive methods and your family planning goals. They ensure you understand the risks of oral birth control failure and the strict rules around the 8-week washout period. They offer Semaglutide and Tirzepatide, but they also offer metabolic support like berberine, which, as we discussed in episode 10, is a highly effective supplement for managing insulin resistance in PCOS. Having a clinical team that understands how to maneuver these different tools is critical for women's health. 24-hour provider review, transparent pricing, no hidden membership fees, 2-day UPS shipping. Visit TelehealthFX.com. That's TelehealthFX.com. The Ozempic Baby trend is real biology at work. It's a testament to how profoundly these medications heal the body's metabolic function, but it also demands respect and proper medical management. If you want a weight loss program that treats you like a whole patient, visit TelehealthFX.com. That's TelehealthFX.com. Take the free qualification quiz and talk to a provider who understands women's health. That's TelehealthFX.com. And as always, everything on TelehealthFX Talk is for educational purposes only. This is not medical advice. GLP-1 medications are contraindicated during pregnancy. Always consult your prescribing physician and your OBGYN regarding contraception and family planning. Individual results vary. Thanks for listening. Share this episode with any woman you know who is taking a GLP-1 and using the pill. We'll see you next time on TelehealthFX Talk.